There are so many exciting things going on right now in veterinary medicine. It truly is a fantastic time to be a cat. Oh, it may sound odd, but most of the veterinary information we have for small animals, so dogs and cats, comes from the dog model, meaning cats don't traditionally have a lot of cat specific studies or products specifically designed for cats. And that is rapidly changing, and it is super exciting because we've said it for years. Cats are not small dogs, they are very much their own creature. But oftentimes we are left with, okay, this is what we know in dogs, this is what we use in dogs, we need to translate it to cats because there just hasn't been a huge study focus for cats or a huge drug marketing focus for cats. And like I said, that is changing. So I want to bring a couple of updates in this video, and it's very much the reason I love veterinary medicine is because things are constantly changing. We're always learning more, and that means I can come to you with these changes and these updates. And one of the things I want to give you an update on is Porus One. So for a while, the jury has kind of been out on this particular product for chronic kidney disease, mainly because the way it's studied, we can't really confirm in general practice. The way they brought it to market and the way that they proved it was effective is using a blood test that is not something traditionally run in a private small animal practice. So we can't start a patient on Porus One and do a recheck 4 weeks later of a blood value and say, yep, it's working. We're essentially left with what we perceive of is it working. And not that that's an awful way to approach this, but humans are absolutely notorious for the placebo effect. We change one thing or we change multiple things and we think we see a benefit to it, so we automatically assume that we did this, that's why our cat is feeling better. And sometimes that's the case, but more often than not, it's not the case. So because of that, Porus One has been one of those supplements that the jury's kind of out on, because any of us who are a little bit more jaded about the products that we recommend or use prefer to have some sort of a solid confirmation, and we're just not able to do that with Porus One. And we still aren't. However, there are additional studies being done by independent parties, meaning people that aren't actually the company selling the product. There are additional studies being done that have helped strengthen our faith, should we say, in this product. One of the things that is coming out in these studies is the fact that Porus One can be used with a phosphate binder. So the two do not bind each other and, negate the effects. So phosphate binder is specific to binding phosphorus in the gut so that the body can't absorb it, therefore lowering the levels in the blood and theoretically making a cat with chronic kidney disease feel better. The Porus One product actually binds some of the byproducts of protein metabolism. So we now know, okay, two separate products, two different goals, they both can be used together, which is great knowledge to have. The other thing that we have learned is that Porus One does not bind amino acids. Now, amino acids are the building blocks of protein. And cats need protein. At least that is what you will hear. That's the common marketing thing. That's the cats are obligate carnivores. They have to have protein. That's the buzzword, so to speak. Well, cats need amino acids. So the reason cats are obligate carnivores is that there are specific amino acids that their body cannot create, meaning they have to eat them. That is the only way their body can get these amino acids. If they don't eat them, we have health problems. If they eat them and they eat them in a high enough quantity, fantastic. Our cats are getting their amino acids. Well, amino acids, building blocks of protein, that means they are part of protein digestion. We now know that Porus One will not bind amino acids, so it should not cause any deficiencies there either, which is great news. And almost more importantly, in my mind, it seems like it's relatively well accepted by many cats. So you mix it in with food. I don't recommend that you mix it in the food that we want the cat to be eating, so their daily diet, so to speak. but there's a product that they made that you can mix it in, or you can just mix it in with something else that your cat really likes, just a small amount. Now, the recommendation still stands that you should be giving it 2 hours after everything else that you give, any other medications and supplements, because we truly don't know the extent of what it binds. At this point, we're mostly looking at the really important things of what may it bind with, may it not bind, and kind of going forward from there. Because as a supplement, the chances of the company doing these really in-depth studies are pretty slim. If it were a drug where it had FDA oversight and regulation, that's a different story. But as a supplement, there's not usually a lot of follow-up studies that go with it. But overall, like I said, the 3 important things that have come out are you can use Porus One with a phosphate binder. Porus One does not appear to bind amino acids, and it seems to be relatively well accepted by cats. So good news there. Next item I want to update is Varenzin-CA1. Both of these products are products I've talked about in prior videos, so if you haven't watched those videos yet, go back to get all of the details. These are just the updates that I want to bring to you. So next product, Varenzin-CA1. This is a product designed for chronic kidney disease and anemia. And essentially, what's important to know about Varenzin is that the studies that were done to bring this drug to market were done in otherwise healthy animals. Meaning we're using this product in a cat with chronic kidney disease that could have a dozen reasons why they are anemic, but we are using Varenzin to theoretically stimulate the cat's own body to produce the hormone needed to produce red blood cells. Traditionally, we would give an injection of that hormone, and there are pros and cons to that. But now we have this new option where we can hopefully stimulate the cat's own body to make its own red blood cells. Now, the reason it's important to know that the study was done in healthy cats is that's where the label claim comes in. So when a study is done to bring a drug to market, the label that shows up on that drug is going to be because of what they learned or saw in the study. So if we are taking otherwise healthy cats that have a normal amount of the hormone needed to produce the red blood cells, meaning they're not anemic, then it stands to reason at some point if we are stimulating their body to produce more of that hormone, they're going to have too many red blood cells. Yes, that's a thing. So for healthy animals and for animals with a totally different disease, you can have too many red blood cells floating around in your bloodstream. It leads to all sorts of crazy things that we won't talk about here, but it is a possibility, it is a thing. So when you are giving a product to a healthy cat to stimulate their body to produce more hormone that they already have to produce more red blood cells, it stands to reason at some point we're going to have to stop the drug because we have too many red blood cells present. And that is exactly what happened. So on the label with Varenzin-CA1, it's a once a day medication until you get to a certain point. And at that point, then the label says you need to stop this medication for at least 7 days. And that label came into play because at that day, that's when they were seeing a number of cats with red blood cells off the charts. They needed to stop the medication. They stopped it for a week to let everything calm down, and then you're able to start it again. Now, the difference is our chronic kidney disease cats aren't normal. They're not even close to normal. The reason we're even looking at using this medication is because they are anemic. And we hope it's only because of this hormone problem that they're anemic, but the reality is there is a bunch of other reasons they can be anemic. So recently I was talking with one of the researchers in this field, and she had made mention that in her experience, in her line of work and research, about 50% of cats with chronic kidney disease on Varenzin will respond as expected by day 28. That means, in theory, some of these cats, if we were to go longer than that, may respond, and some of these cats aren't going to respond no matter what we do with the Varenzin because they don't have enough of the hormone to do the stimulation thing anyway. So when you are starting your cat on Varenzin, or if you are talking about starting your cat on Varenzin, keep these things in mind. The study was done on normal healthy cats. Your chronic kidney disease cat, unfortunately, is not a normal healthy cat. And if you are seeing a response to the Varenzin, but not necessarily fast enough or not necessarily complete enough at that 28-day mark, they may be in the 50% of animals that needs longer to respond. So this is one of those medications that will very likely be used off-label to some degree, meaning we have a approved drug, we have an approved label or directions that go with it, but we are finding in the field we need to do something else, and that is off-label. There are pros and cons to that off-label recommendation in term, but it's definitely something to have a conversation with your veterinarian about. But overall, keep in mind that about 50% of cats with chronic kidney disease responded. Some took longer than others, but this is something that is coming out based on our use and experience with this medication. The third topic I wanted to bring up is something called the reverse study. The reverse study is actually something that occurred because of the HALT study. I know, great names, right? So we've got the HALT study, which is a study specifically on cats with hypertrophic cardiomyopathy. This particular disease is the bane of our existence when it comes to heart disease in cats, because not only is it really hard to find sometimes, but we don't have a lot of great options for it. So that study happened with a drug called rapamycin, and it's incredibly promising to say the least. As they were studying other things or looking at other parameters in this specific study, they realized that it's looking like there's going to be some potential kidney benefits of rapamycin. So now they have launched a second study called the reverse study to look at the specific benefits of this medication and chronic kidney disease. So we don't have a ton of information on this yet. Again, super exciting time to be in veterinary medicine, and we will have more information in the future. But I wanted to drop that little tidbit that rapamycin is looking like it may be promising for our chronic kidney disease cats. And if you are one who would like to participate in these studies or help our knowledge with these medications, definitely either look up the information for that study or throw a comment under this video and I can, get you a link to get to that study. But rapamycin is a medication that is looking like it has some potential promise for our chronic kidney disease cats. And that makes me so happy and warms my heart. So again, quick summary, we talked about Porus One, we talked about Varenzin-CA1, and now I was just talking about the reverse study and rapamycin. Take care.